Let's make a start. Morning, everybody. A very warm welcome to colleagues from across Cheshire and Merseyside for the session today. My name's Helen Bromley and I'm the Director of Public Health from Cheshire West and Chester Council. And I'm the Lead Director of Public Health for workforce wellbeing and development across the patch. Just a bit of housekeeping before we go into the session, if I may. We've muted mics for the webinar today, just trying to keep the noise levels down, etc. There is a Q&A function at the top of your screen. It's in the 3 dots that say more underneath it. You can find it there. If you could put all your questions into the Q&A function, that would be really helpful. Thanks. But we do have the chat function as well. Comments only into the chat function. Don't put your questions in there because we might miss them. We'll try and answer as many of the questions as we can as we go through the morning, but any questions that we haven't got time for, we'll follow up after the event and get back to you all. We'd encourage you to use the hashtag CM Systems Leadership on any social media platforms, please. And please note that we are recording the event to share with you afterwards. So just want to say a bit about Champs Connect and Learn, really. This is an opportunity for us to come together, learn something new and connect with colleagues across Cheshire and Merseyside systems, allowing Cheshire and Merseyside to strengthen its public health collaborative to improve health outcomes and tackle inequalities. We are all champs. It's not something that sits hosted by Wirral. We are champs, ably supported by the Champs support team. Alongside this event, we run a programme of CPD events, all promoted in Collaborate, which is our newsletter, which you can sign up for on the Champs Collaborative website. Links will be shared in the presentation. So just a bit of background as to why we're running the Systems Leadership webinars. We did a training needs analysis undertaken by Cheshire and Mersey local authority colleagues last year. And there was a strong request to understand more about systems leadership. So we held a first workshop in March 2025, which introduced basic ideas around the topic, with speakers from across Cheshire and Merseyside bringing their own reflections on using these approaches in practice. And that was a really well received webinar, and this builds on that earlier webinar from last year. So I'd like to introduce our first speaker, if I may, Debbie Sorkin. Debbie is the National Director of Systems Leadership at the Leadership Centre and has more than 20 years' experience strengthening leadership in public services. Since working for the Leadership Centre for the past 10 years, she's worked with local authorities, the NHS, government departments and national bodies. She currently works with OHID on a systems leadership programme for public health professionals. So I'd like now to hand over to Debbie, who will take the session forward. Over to you, Debbie.
Thank you very much, Helen. Good morning, everyone. Thank you for being here and for making the time. I appreciate how busy everyone is right now. So today, as Helen says, we are revisiting systems leadership, but this time putting it in a whole system context. So as well as having a recap on how systems leadership can help in our current environment. We'll also hear from colleagues from Public Health and NHS Wales about applying whole systems approaches in their healthy weight strategy and evaluation methods. We're also going to hear after the break from Duncan Radley from Leeds Beckett University, who will talk about system and ripple effect mapping to help us identify and track the effect of system-wide work. So I'm going to introduce things first of all. As Helen has said, I'd encourage comments in the chat and questions in Q&A. So wanted to start, and thank you, Anthony, wanted to start with a brief introduction to whole systems approaches. Obviously, I know many of you will already be familiar with this, but in case there's anybody who isn't, a whole systems approach, a WSA, is a way of working where you've got issues that have a range of different components and interests and people and sectors and priorities and perspectives. And the key thing that differentiates a whole system and a whole system approach is that you see these different components as interconnecting with each other. Think of them as some sort of giant Jenga. They're not just on separate tracks. So if you take action in one area, it's likely to have knock-on effects, sometimes unexpected in others. So what you try and do when you're looking to have a whole systems approach is to bring these interconnected parts together, to raise awareness amongst the different people and the different organisations and sectors that, hey, you are working in a system here, and by the way, your actions might have knock-on effects, and then look together at A, what those effects might be, and B, what some solutions that actually take all this into account might look like. So you can actually align your efforts and you can promote systems change over the long term. So you think of it as working a bit in a herd or in a shoal rather than just animals going in single file. For nothing else, you might be able to ward off some predators that way as well. This isn't a new thing. We've put some links here into examples of whole systems approaches, and there are whole systems approaches happening at the moment, we know, in Cheshire and Merseyside, and also Derby and Derbyshire. So if that is your area of interest, please look at those as well. If I could have the next slide, please, Anthony. The thing about whole systems is that they are often complex, and complex has a specific meaning here. I'm using the model developed in this case by a man called Dave Snowden. Dave started out as an anthropologist, but now works in this field. And I know there is the line, all models are wrong, but some are useful. I happen to think that this is particularly useful when you're looking at complexity and when you're trying to take a whole system approach. So Dave's basic contention is that some of what we do is simple, some of what we do is complicated, and some of what we do is complex. So simple things, you do one thing, and something else reliably, predictably follows. You go into a room, switch the light switch on, usually the light comes on. Do one thing, something else follows. Complicated things are where you take a number of steps. So you don't just do one thing, you take a number of steps based on your expertise or specialist knowledge. And again, you know that if you do these things, even if they're difficult, you will get the outcome you're looking for. So back in the day, if you wanted to build a Nightingale hospital during COVID, Colonel Ashley Boreham here, and the photo was your man. He had done this before, knew what to do. What to do was difficult, but he knew that if you followed the project plan, all the interdependencies, he would get the outcome he was looking for. So in a simple or complicated situation, cause and effect applies. You can say, we'll do this, and this will follow. But in a complex situation, that doesn't apply. So if I could have the next slide, please. Complex situations are often to be found when you're looking to apply a whole systems approach. Complex situations or complex issues are more elusive, are more shape-shifting. These are the things that are deeper seated and involve lots and lots of different partners, but not necessarily lots and lots of resources. There may be a political dimension of one kind or another. And the key thing to note with a complex issue when you are working with a whole system is that that idea of cause and effect does not apply, does not obtain. So you won't be able to say, if we spend this much money in our system on this thing, we will definitely get the outcome we're looking for. You know, we can bet the house on this. You might get it. You might get a bit of it, it might be a bit meh, you might get something completely different, or you might get nothing at all. Key thing is that you will only know after the event. You won't be able to predict in advance. And when I say you, I mean everybody in your team and everybody in your whole system. This is not about seniority. So when you've got a complex issue as part of a whole system, and you want to take a whole system approach, you're probably going to need to work differently. Going to need to experiment, to try things out, to amplify what works and to stop doing what doesn't, frankly. We are very good at starting new initiatives. We're not quite so good at stopping things. And that can be massively countercultural when you're working in the NHS, which, to be honest, never met a plan it didn't like, or when you're working in quite structured environments like local authorities. So, good news and bad news. If you have something that is a complex issue and you decide to treat it as such, then you will at least be dealing with reality. And I always think that's a good place to start from. Bad news, not everybody is going to thank you for this. If I could have the next slide, please. It can be seen as risky or countercultural or a distraction. And some people will go to enormous lengths to avoid doing anything around complexity, to avoid really thinking in a whole system way, to keep on thinking in terms of parallel tracks rather than interconnection. And you can get smoke blown in your eyes from all sorts of directions. And I put some of the things that people can do in the list here. So a couple of things just to note. People love doing the wrong thing busily. You know, I've got this thing to do, so I'll definitely do it, irrespective of whether it will be helpful or not. Obscure or vague language, especially when you're working in a whole system and you have different people's jargon, different people's ideas. Say, for example, what a neighbourhood is. Really important. If you're working in complexity, if you're working in a whole system, to get clear, not only on what you mean by something, but what somebody else means by something, especially when they're using the same word. And to note that this is not necessarily when a whole system is looking at doing something different. People don't necessarily fear change, but what they absolutely fear is loss. People don't necessarily fear change, but they fear loss. And yeah, at the moment, absolutely, loss of job, you know, stark as that. But quite often, it's the stuff going on in people's heads. Loss of face, loss of control, loss of status, loss of dignity, loss of identity, especially professional identity, loss of certainty, stability, familiarity. These things don't need to be rational, to be real in people's eyes, but they will absolutely be there. So I'd say, just think about this before you go into the meeting with the whole system or with part of it. Worth actually going for a coffee with somebody beforehand. This is real work, by the way, and think about what the potential losses might be that people might have in their heads, and then couch your arguments in terms that show that you've recognised or acknowledged these. You don't need to solve them, but just acknowledging them can go a long way. So watch for these things. Don't file them under R for random. They're not. They're people trying to avoid the real work that goes with complexity. Couple of other responses to watch out for, if I could have the next slide, please, or to notice that they're happening. You can't control your way out of a whole system or out of a complex issue. Fine if you've got an emergency. If you haven't, if you're trying to do something to align different people and different views and perspectives, you need distributed leadership. You need everybody feeling that they can do something. Otherwise, you'll just gum up the works and everybody will be waiting for you or your boss, or preferably their boss, to actually tell them what to do. Try not to jump to solutions. This can feel weird because we have spent our entire professional careers bringing solutions to the table. Doesn't mean to say you don't find a solution, just don't come in with your first hot take, because when you're looking to align different interests, your first hot take is likely to have unexpected consequences. So worth asking a few questions first of all. Try and inculcate a learning environment rather than a blame culture, just pointing the finger. Much better to understand what is happening and why it's happening, rather than saying, well, if it weren't for them. Try not to pretend everything is a success. You're innovating, you're doing something really difficult here. So some of it is likely to work, some of it isn't. Fine with what works, amplify what works, and tweak what doesn't. But don't just pretend that there aren't mistakes or rocks in the road. And also to note that the answer to a whole system issue, a complex issue, is not to have just another meeting about this. You cannot manage your way out of this. What you need to do is to work differently. And we are not powerless in these situations. If anybody ever says to you, oh, we can't do anything, it's a whole system and it's all too complex. No. Some bits of it might be complicated, but even for those parts that are complex, there's a lot we can do. So if I could have the next slide, please. There's a lot we can do in these situations to give ourselves room for manoeuvre and to tip the scales in the favour of progress and change, even if so much in a system is going to be outside our control. So I want to spend the next 10 minutes or so just talking about some of these approaches. If I could have the next slide, please. First thing, see this as a leadership issue. You are all leading in the system. Please note, I use the word leading, a verb. I don't use the word leader, because this is not about being the putative leader. This is not about being senior. This is not about your banding or your grading or your seniority. This is about leadership as a practice, which we can all practice and get better at, because it's about actions and behaviours and showing up. One of the nicest definitions I've seen of leadership is this one here at the top by a man called Marshall Gantz. Marshall Gantz is still around. He's in his 80s now. He's now at Harvard. Started out at Harvard in the mid-1960s and dropped out to join the civil rights movement, a whole system change if ever there was one. So a man who knows all about facing really unpropitious circumstances and people who might not want to change. And he has this lovely line: leadership is taking responsibility, so it's acting, doing what you can do, for enabling others. So it's always, and especially in a whole system, something you do in relationship to others. You're never just following your particular track. To achieve shared purpose, which we'll come on to, and in the face of uncertainty. In a whole system, you're inevitably dealing with uncertainty and not knowing about sort of second-order effects. But that doesn't mean to say that you can't act. And leadership is a hopeful act, because along with the uncertainty is also the possibility of change. So always see yourselves as being able to influence a system and affect how it thinks in order to change what actually happens on the ground. And there are ways of working that help here and that are available to everyone. So if we could have the next slide, please. Do not have imposter syndrome, okay? Wherever you are in your systems, however much power you think you have, or you don't have, you are the right person. People in your teams are the right people to be doing this work. And there are approaches that you can use to make progress that have been developed specifically for these kinds of situations. If we could have the next slide, please. Sometimes called systems leadership, sometimes called adaptive leadership. I had the God of small things earlier. If you're thinking about a whole system, if you have that word transformation in your job title or job description somewhere, it can be tempting to think, I've got to do something big. Actually, no, you've got to do something, but what you do needs to be small and practical and doable, based on what you can control, or influence. So if you look at these concentric circles on the left, the CIA acronym, it's not the American CIA. C, what can I control? I, what can I influence? And A, what do I have to accept for now? Not necessarily approve, but what, I've got other priorities right now. So you start from where you are, you start from where others are, you go where the energy is. I'll come back to shared purpose shortly, but I just want to mention relationships. Doesn't mean to say hierarchies don't exist, power dynamics don't exist, they absolutely do. But if you've got relationships, you've got the possibility of trust. And if you've got trust, that's when you can influence. That's when you can influence. Try things out and see things in terms of networks rather than rigid boundaries and silos. You've got a semi-permeable membrane there. You can absolutely use this. So I want to talk about three things. I want to talk about actions and behaviours, first of all. I want to mention relationships, and I want to mention shared purpose. So if I could have the next slide, please. First of all, absolutely get explicit. What are the behaviours I want to see? What are the behaviours I want to hold other people to, and how am I going to do that with others? If you've got respectful behaviours, then you've got the possibility of a relationship. And you can write these down. If I could have the next slide, please. This is another part of the country, obviously it's with their permission. This is what they did in primary care in Devon, where the behaviours were not all that they might be. Came up with rules of the house, especially under pressure. There's nothing egregious here. You would do something very similar. Honest conversations, active listening, constructive criticism, challenge the organisation and assume good intentions. Really worth having a go with this. And there are some behaviours, if I could have the next slide, please, that are extremely helpful when you are working in complexity. This is some research that was done a decade ago around what are the behaviours that help when you're working in complex situations. And this is about, as I've mentioned, practicing systems leadership. And I always say it's about leadership for introverts. Because it's about being thoughtful and reflective and helping and supporting other people. So worth noting, if I could have the next slide, please. There are some behaviours that really help here. A couple I just want to flag up. Can you get some time for reflective practice in your week? Making time for an observing eye. What is actually going on here? And can you enable and support people to try out new things without it being in that dread phrase, career limiting? Absolutely worth thinking about this. And once you think about behaviours, then you can move on to relationships. If I could have the next slide, please. Not fluffy. This is about not soft skills, but higher order skills. And where you're working here is to use influence to change outcomes across a system, or to convene parts of a system and bring them together, and to do this in advance when you're working in a whole system so that you can take advantage of opportunities as they arise, which is what David Lammy did in 2024. At that time, he was Shadow Foreign Secretary, shouldn't have been at the D-Day commemorations, but had spent months developing relationships with his counterparts in France. And when the time was right, they could push. Those rules turned out to be conventions. So absolutely think about who you want to build relationships with. And then, absolutely crucially, if I could have the next slide, please, ground your whole systems approach in shared purpose, not governance, not structure. With a few people who think the way you do to start with. What is it we want to do? Why do we want to do it? What are the benefits going to be? This is absolutely about what's our agenda here. There'll be times we need to feed the beast, but what's the prize we want to keep our eyes on? How are we going to make it practical? About the consequences, what are the experiments we might want to use? It doesn't need to be about everything. It can be in plain English and one side of A4. So if I could have the next slide, please. This is an example, again, from Devon. Just get it onto A4. You can start lots, you can start detailed and then bring it down. And if you do these things, if you work in these ways, then you can have some very different conversations and different outcomes. And I just want to finish with an example. Next slide, please, from Calderdale. This was about physical activity in public health. Getting schoolgirls to take up different forms of physical activity and more physical activity. Started out thinking, they'll want aerobics, won't they? They'll want Zumba. We'll write to the parents. And then they did a great thing. They actually used their networks. They thought, who isn't in the room, who needs to be? And they brought the schoolgirls in. And they trained the schoolgirls in research methods and got them to do the research. Schoolgirls had no formal power, but they could influence and they could change the rules. They could push for new possibilities. So the outcomes were not aerobics and Zumba, but taekwondo and boxercise. So the key thing, I think, and if I could have my last slide, please, take action. Try something, see what works, amplify what works, and shut down what doesn't. I always think people should post Myron Rogers' maxims to the wall. And I just want to say two things. First of all, start anywhere, follow it everywhere. Key things to make a start. And let's do something different. Because if we do the same thing, we are likely to get the same outcomes, especially in a whole system where there is likely to be so much pushback. So the process we use to get to the future determines the future we get. And we just need a bit of a different process. So I'm going to stop there. I've got a few minutes before I need to hand over to Sophia and Lydia. But just now, I'm going to have a look and see if there are any questions in the Q&A. See if I can answer. There's one from Lucy, Lucy Hill, thank you. Given the current climate and instability in the system, how do we encourage people not to feel disempowered to continue to deliver powerful change? I think this is a crucial question. It's so easy at the moment not to take action or to wait and see. And the way I always put this is do something that feels small and practical and doable, Lucy, and then just allow change to build up and accumulate over time. And don't do it on your own. Few people who feel the way you do, a coalition of the willing, so that you're not feeling on your own. And don't beat yourself up because this stuff takes time. It absolutely does. So now want to move on. I'd like to introduce two people, please. Sophia Bird, who's the Principal Health Promotion Specialist, Obesity and Nutrition in Public Health Wales, first of all, and Lydia Orford, who's the Principal Public Health Practitioner, I'm going to say this wrongly, Betsy Cadwallader University Health Board, NHS Wales. For Sophia has been a Principal Public Health Practitioner with Public Health Wales since 2019, and prior to this she was a Principal with Power's Public Health team. Her focus is on obesity prevention and systems working, and she's currently the national lead for the Wales-wide whole systems approach to healthy weight. Sophia has over 25 years experience working on various public health issues at national and local level across Wales. Lydia is leading the work around whole systems approaches to healthy weight in North Wales and has been part of the whole system team since its inception in 2021. And previously she worked for Public Health Wales and Cheshire West and Chester Council, and again has many years experience of working in public health and at local and national level in England and Wales. And they're going to look at going from vision to action, lessons from Wales's whole systems approach. So, Sophia, Lydia, over to you. Thank you.
Thank you, Debbie. We're delighted to be here, and thank you so much for inviting us to give us a little taste of the experience that we've been having. And Debbie, a lot of what you've touched on really resonates with us, I think, and I think you'll see it's reflected in the slides in our experience and what we're about to talk about today. So I just wanted to set the scene a little bit to give you an idea of the challenge we have in Wales. Around 61% of our adults are living with overweight and obesity at the moment. It's estimated that an additional 10,000 people will move into this bracket each year. The population of Wales is around 3.3 million. And if trends continue, it's predicted that there will be around 1.63 million people in Wales living with overweight and obesity. And like many other areas, experience rates are highest in men and women 45 to 64 years old and highest in our areas of deprivation. In terms of the strategic context, Wales is a little bit different from England. We have two key pieces of legislation that influence how our local authorities and health boards operate. These pieces of legislation give a legal obligation for our local authorities and health boards to improve our social, cultural, environmental and economic well-being. We have 7 health boards in Wales and we have 22 local authorities. And each health board has a responsibility to have a regional partnership board made up of the chief execs of all the key public bodies across their region. And each local authority has a key duty to have a public service board, again made up of the chief execs of the key bodies across their region. And these work in a similar way to the health and wellbeing boards in England. And these boards are established to improve the wellbeing of the population, improve how health and social care are delivered, and demonstrate citizen engagement and co-production. We also have our Healthy Weight, Healthy Wales strategy that was launched by Welsh Government in 2019, and that has 4 themes, and our whole systems approach sits under the 4th theme, leadership and enabling change. So our programme in Wales is unique in that it gave us some funded posts, of which Lydia is one. We have these officers who are our system leads, and they are based in our public health teams across Wales within each health board, because in the NHS, public health is still part of the NHS. As a result of getting our officers in post, we were able to deliver a series of training and development events. We've created some assets, including our 9-step process to taking forward a whole systems approach, which was built on the PHE Leeds Beckett approach, but breaks some steps down a little bit more and recognises that these are not steps that are taken in a linear approach, but will be happening at different points, and often multiple steps will be being taken forward concurrently. Next slide, please. So our approach at the national and regional level has 3 phases: the setup, recruitment, training and governance. The engagement, where we are connecting with our system, the key movers and shakers, identifying who they are, identifying maybe people who don't recognise that they're in the system, and then working together collaboratively to develop shared actions, so aligning people's goals and priorities through ways of working where we can each see how we can work towards the shared goal. And if you move on to, yes, thank you. So far across Wales, each of the health board areas have identified a system theme, and then within that particular bit of the system, so what we call a subsystem or a priority bit of the system, where they're identifying particular issues that those people working collaboratively have agreed is the important thing to do. And one of the other strengths, I think, of our approach in Wales is that we're very actively ensuring that learning developed in one area can be shared across other regions, and so that change happening in other regions might be able to happen a little bit faster, because we've got those learning points of what has worked and what hasn't worked, and that learning and reflection is built into our approach right from the beginning. Just before I hand over to Lydia, I think the other bit about that is a key part of our approach in Wales is it's not just happening at regional and local level, but it's also happening at that national level. So Public Health Wales is able to pick up some of the issues that are challenging at a local level that maybe are across Wales, if you think about some of the planning regulation or transport issues, for example, and we're able to raise them because we work closely with our Welsh Government colleagues. We built up that relationship of trust, and collaboration. So we're able to feed things up and down the system. And I think that is another key strength of us. So I'm now going to hand you over to Lydia, who's going to talk you through the on-the-ground experience of North Wales.
Lovely. Many thanks, Sophia, and really thanks for setting the scene for our work here in Wales. So as Sophia explained, there are regional Healthy Weight Whole System teams within each health board area, and I lead the Healthy Weight Whole System work in North Wales, working for the Public Health Directorate in Betsy Cadwaladr University Health Board. And I'd like to use the next few slides to talk you through our journey over the last 4 years. Next slide, please. Thank you. So Sophia introduced the 9-step approach, and as regional teams, we have been working through this over the last 4 years. We have followed the steps, revisiting some of the steps throughout the journey, so such as setup and buy-in and system engagement, which constantly need to be repeated as the system changes and evolves over time. We have completed some of the steps out of sync if system levers become available. So, for example, we carried out our social network analysis earlier in our journey as funding became available. So that was a lever we could push. So although it is a 9-step cycle, we don't necessarily follow the steps necessarily in order, dependent on levers in the system, and that need to revisit many of the steps. Next slide, please. Thank you. So reflecting on the start of our journey, we worked through steps 1 to 3. So the team was recruited, senior buy-in was secured through our regional leadership board and our health board governance. And we developed our system narrative that told our healthy weight story and was adapted and framed in language that resonated with our system partners. And that was really important, that we talked about eating well, we talked about being active, we talked about changes to the physical environment, to the food environment, not just talking about healthy weight and obesity. We spent much of this time relationship building, and like Debbie talked about in her presentation, we met people for coffee. We really laid those foundations and built those relationships, and that was really important. We also used behavioural science techniques, again, which Debbie talked about, thinking about those system partners and stakeholders as actors in our system, and that their behaviour influenced the way that this work was embraced by the system. So our first system engagements events, which was step 4, were held in March 2022, where we brought our system partners together to map the factors that cause overweight and obesity in North Wales. We commissioned Leeds Beckett University to support us with this element and held 6 workshops across North Wales. Within these workshops, we identified 97 causes of overweight and obesity, and that was due to the variety and the number of partners and stakeholders in those workshops. We produced 23 system maps and identified 5 key themes. One of the key elements that Duncan from Leeds Beckett resonated with us was that bit about not jumping to solutions, which again, Debbie, you talked about, and that was what we all wanted to do at that very early part of our journey. Alongside this, we carried out a social network analysis that allowed us to have a baseline view of the maturity of the system, both from a healthy weight perspective, but also from a whole system perspective within North Wales. Later in that year, in September, we then carried out the next stage of our system mapping journey, where we rationalised those 5 key themes into 3 priority subsystems that Sophia referenced in her slides. And they were the ones that partners felt they had the most influence over. And for us in North Wales, they were access to affordable and healthy food, eating well and being active in schools, and eating well and being active in workplaces. And it is these subsystems that we've been taking a whole system approach to over the last few years. The system was then mobilised, which is step 8 in that 9-step cycle, where our governance was established and a strategic delivery plan was produced, actioned and refreshed, and that being that step 7. February 2025 last year saw us take a deeper dive in our priority subsystems by carrying out causal loop diagram mapping workshops with our system partners, again with support from Leeds Beckett University. That brings us to where we are today. We are just completing a repeat of our 2022 social network analysis to see what change there has been in the system over the last 4 years. And we're analysing those causal loop maps to identify those actions that the current system can have the most influence over and impact from. Hopefully that gives you a flavour of our journey to date. Next slide, please. Thank you. So looking at examples of emerging success over that time, we are seeing the development of a healthy weight whole system approach across North Wales with robust governance, shared vision and goals across system partners, with whole system approach to healthy weight as a priority across that system. So very much that shared goal, that shared vision across the system. We have more partners working within a whole system approach to healthy weight and an increase in the diversity of partners from traditional health and leisure to a wider spectrum of partners from planning, regeneration, education, third sector, etc. And we've shown progress against all of the steps within the 9-step whole system approach. We've also increased awareness of whole system approach with partners and stakeholders who we have trained in whole system approach methodology and working in a systems way. An important step in ensuring systems literacy, buy-in and understanding in working in a systems way. We have developed principles for working in a whole system approach and are seeing the impact this is having in ways of working, as well as embedded within structural policies and strategies across North Wales. Thank you. Next slide. And how are we shifting the system? So within our subsystem priorities, we've had a focus on spatial planning, and this has led to health being included within local development plans and planning applications being refused, conditions added, and our comments included in case officer reports and recommendations. And that's a real shift in the system and an example of system belief and shared system goals across North Wales. We have supported system partners to review public sector food and drink procurement, leading to healthy food and drink being normalised within this space. We have done this through service specifications, tenders processes and skilling up the workforce. Again, another example of structural system change. Alongside this, we've developed a number of system resources, such as best practice guides, checklists and policies. Again, another structural system change. And we have worked to embed physical activity across organisations and infrastructure through initiatives such as Active Souls, workplace policies and influence in planning applications. And this is an example of initiatives ranging from event level action through to structure system change. Thank you. Next slide, please. But how do we know we're having an impact? What is that impact of this work? So I've mentioned social network analysis earlier, which is the image on the left. That's from our social network analysis in 2022, where it shows the partners and stakeholders and the role that they play within the healthy weight system. What will be really important is when we have the results from our 2026 social network analysis, and we can see have there been any change within that system maturity and those partners and stakeholders within that time. Another non-traditional evaluation tool we are using is ripple effect mapping, and the image on the right shows a ripple effect map in action. But I know Duncan is going to cover this later on this morning, so I won't steal his thunder and I'll leave that there for now. Handing back to you, Sophia. Thank you.
Thank you, Lydia. Next slide, please. So just thinking about some of the key learning that we've had. We've really learned the importance and the focus for us is about shifting from the individual to the system by framing, as Lydia touched on, obesity and healthy weight through the system in terms of the food that we eat, the environments that we walk in, the opportunities to travel actively, for children to play, all these interconnected things. That's really helped our partners to see how we can align priorities and goals. And that has built on towards our development of shared visions, common agendas, and aligning measures of success as well, rather than the usual counting the numbers through a training programme, for example. And as Lydia has already demonstrated, seizing adaptive approaches, those opportunities where we can align with partners so we both get the work that we're needing to achieve. And this has come about fundamentally through developing those trusted relationships. And I cannot emphasize that strongly enough. This is all about relationships, building those relationships. And that can be challenging when people are saying, what are you doing with your time and what's the outcome of that, or what impact is that making? But without having a good relationship with somebody, it's really difficult to work together. And I think if you reflect back on when you've been given a new piece of work, often the first thing we think about is who can I speak to who can help me with this? And by building those strong relationships, we do definitely get that increased buy-in and that shared accountability and that stronger advocacy for change. And one of the results that we've seen of this is that our public sector service boards now all have some variation of healthy weight included in their wellbeing plans for action. And this is something that a few years ago was seen as entirely an NHS problem and nothing to do with them at all. So for us, that's a really good marker of change. Next slide, please. What we do differently now, building and strengthening relationships. That's our number one thing. We use system thinking tools. We've already touched on a few of them, but really, if you think about, we try to really understand who is in the system. We want to zoom out, as it were, to get a good understanding of the people who are in the system, the geography of the system, the assets within our system, understanding what's already happening, who those things are targeting. We really try to understand those factors that influence our behaviours, and that's helped us to identify the issues that we want to address, recognising that we cannot tackle the whole system at once, and we need to work together just to tackle one small part of the system. And by identifying this bit you want to focus on, the issue you're wanting to address, actually you're going to then, that will help you to identify who the key movers and shakers are for that bit of the system. And that's really, really important to be clear on what it is you're wanting to address, what the issue is. We're focusing on policy and strategy influence because we recognise that that is where we can make legacy change, because our organisations will be following new policies and people are within organisations. So that might look at the spatial planning responses that we now make, how we try to influence those, looking at healthier advertising policies and how we embed those within our commissioning processes, for example. And as Lydia touched on, we're using behavioural insight, but because we're applying COMBI at organisational and policy level, because again, it is individuals who deliver policies. And our evaluation tools, we're focusing on people, not numbers. So we're really having to use snapshots in time. Lydia touched on the social network analysis, that can help demonstrate relationship changes over time, thanks to that investment in building relationships. And as Duncan will talk about later, we're using ripple effect mapping, because again, that's showing how change unfolds and how action to focus on one outcome can often ripple into have other unexpected outcomes too. And it can help capture what's happened and what changed and why it mattered and what it led to. Next slide, please. So our key lessons, time and process. It really does take time to lay strong foundations. It takes time to build relationships. It takes time to understand how to work in a systems way and how to embed that amongst colleagues and wider partners. And it takes time to build that shared ownership and shared understanding, shared language, shared vision. Enablers and tools for us, definitely having our dedicated posts, having that belief and investment by Welsh Government has made a huge difference. I'm not saying that our posts are protected and are only able to do this work, but they are able to focus on it. They are able to hold the reins, as it were, at national and local level, and that is invaluable. Using the system tools to map and really understand the context that we're all living within, that's been invaluable. But we like to think that things are very linear and that we all behave very logically, but we don't. And being explicit about that is really helpful. Building in reflection and learning, as Debbie highlighted, that's invaluable as well. And for us, being able to hear about the learning at a local level, feeding that up to national level and vice versa is really proving helpful. And it's helping our Welsh Government colleagues to come along the journey with us as well. And evaluation and the network analysis is really helping to feed into that. So as I've sort of touched on a bit already, but get those people and relationships are really invaluable. Getting that active buy-in from our colleagues means that change can happen. Having the community voice, again, I think as Debbie touched on with the last example, was it from Calderdale? Getting people in the room so that their voice can be heard about what are the challenges they experience on the ground without making assumptions, getting that diversity of voice as well. That's really important. And storytelling and story listening, really listening, that can help create the space for change. And it can also, it's part of our journey in terms of the evaluation, the findings, demonstrating change. And as Lydia, I think, emphasised, no one organisation holds the key to change. Actually, the power is in the collaboration and lots of organisations making lots of small change that builds up together. So a lot of this is actually about shifting mindsets. It's about helping people understand that the factors that influence our behaviour are environmental, societal factors. And if we change some of the environment around us, then people have an opportunity to change their behaviour. But at the moment, a lot of the system is fighting against us behaving in a healthy manner. So we are focusing on that organisational policy change, because in a way we're saying, as public sector, let's get our own houses in order. Let's not have leisure centres filled with people supporting people to get physically active and to look after their health that way, and then the food provided through the vending machines or in the cafe is not supportive of living healthily as well. Next slide, please. So really, I suppose our key messages for us looking ahead, we're continuing that strengthening of collaboration, governance and learning. So governance, we found, can be a tool to help keep bits of the system engaged. The learning, the reflection, feeding that in to support the experimentation is really important. And we're focusing on scaling up some of the actions that have occurred at local or regional health board level across to other health boards, so that we get some momentum, because change can happen a little bit easier thanks to that learning. And we're continuing to frame obesity as a system issue in policy and practice. And we're trying to continually get better with storytelling as well. Thank you.
Thank you so much, both of you, Sophia and Lydia. Absolutely fascinating. I love the phrase, the power is in the collaboration. I might steal that. Thank you so much. Even if it takes time, even if not everybody wants to buy in. So welcome back, everyone. Hope you've enjoyed what you've heard so far. Just to recap briefly, we looked at what it means to take a whole system approach. We've looked at some of the systems leadership tools and approaches and ways of thinking and leading that you can employ when you're in these kinds of situations, especially when they link across to complexity. And we've had a fantastic example of how this works in practice and is working in practice in and across North Wales. So for the next 20 minutes or so, I want to follow on from a lot of what Sophia and Lydia were talking about, and to focus on the how you actually do this in practice, and particularly how you can influence across a system, especially when you feel you don't have positional power, you don't have a lot of money to throw around, you don't feel that you're senior in an organisation, or you feel kind of on the outside looking in. So it's worth looking at influence as a whole. If we could have the next slide, please. And to see it as something that you can do directly and indirectly across a system. So it's something you can do, it's something you can get other people to do. And it's a great way to mobilise a system. And if I could have the next slide, please. And see it as a form of power in its own right. Because the great thing about using influence is that you can get creative. You can get creative with what you do. You can get creative with who you do it with. And this is a lovely recent example. So not from Cheshire and Merseyside, this was from Nottinghamshire, and it started up at the end of summer last year, where I'm sure many of you will remember there were a lot of flags and other material going up on lampposts around the country. At that time, the leader of Nottinghamshire Council banned the local newspaper, the Nottingham Post, from speaking to him or to any of his counsellors or officers. So what to do? If you are thinking of just going down a sort of traditional route, a bit like the aerobics and Zumba in Quarterdale, you might think, oh, we will write the leader a letter, we will write them a stiff letter. What you do, though, if you want to use influence to change things, is something different. And anyone can do this. So there was a man called Simon Williams, not a counsellor, not an officer, didn't work in public services at all. So somebody was asking, how can we get providers to do this? How can we get the private sector involved in this? An individual, a local individual, mobilised and used influence. And what he did was, with colleagues, to get copies of the Nottingham Post and start putting them up on lampposts across the UK. So not just in Nottingham, not just in Nottinghamshire, to draw attention to what was going on. And it was called Operation Crybaby. The movement, and this is about social movements, saw hundreds of copies really across the country being tied to lampposts and bridges and flagpoles. Simon Williams said, and I quote, "We thought if there's so many St George's flags being put up on lampposts, then why not copies of the Nottingham Post? They can't take them down because otherwise they'd be accused of attacking free speech. And better still, the paper has a circulation of about 3,000. So if they do take them down, we've got plenty to put back up." And they did this over August. And it had an impact, because at the start of October, the ban was rescinded. Okay. Ban was rescinded. It was all a misunderstanding. We've always been in favour of free speech. So always think of what you might do differently or laterally in order to get change, and who your allies might be in order to do that. So you don't need to do necessarily just what everybody else has done or what's always been done. You can work in new ways. You can work in creative ways. Key thing is to work out, first of all, who you want to influence. So if we could have the next slide, please. This is about knowing your allies, knowing your enemies, and knowing where to start, because we all have limited bandwidth, we all have limited time. If you're in a whole system, there'll always be other stuff to do. So get very specific about who you want to go after or who you want to ally with. And by the way, you might not know, that's fine, that's data, that's your starting point. But there are various ways in which you can map your system in order to work out who you might want to build relationships with. On the left here, just over here, where it says high power and low power and high support and low support, that's about stakeholder mapping. Again, I'm sure many of you will be familiar with this, where you kind of delineate where people are according to how much they support you or even know about you and what you're doing. And I've said how much power they have, but it's really clout in the system. So it might be positional power, it might be money or other resources, it might be influence in the system, it might be relationships, it might be links, it might be networks, but they've got power in some way. Start the top right-hand quadrant with people who can combine support and clout. These are the people to really start with in the first place. If there are people who've got support or clout in some way but don't know much about you or support you less, can you move them along to that top right-hand quadrant? So you can use stakeholder mapping. You can also use an approach which is called actor mapping. This comes from the US. It was used originally in community organising. And here you map out your constituency, who's in your system. not according to how much power and power and clout they might have, but how much they share your values. And focus on them first of all. They are the people who will be crucial in helping you build a movement for change across a system. They might be in competition with you at various times, for money or other resources, but they will also support you. They can be part of a wider constituency. They can take the leadership from you at times, and that's very important, because you must not do this on your own. You cannot take a whole system on your own shoulders. You need other people to be involved. So worth thinking about, almost viscerally in my gut, who are the people who really get this? Who are the people who I feel really have my back? Do not start with the people who oppose your values, okay? You will just be banging your head against a brick wall. I'm always reminded of the saying that Helen Bevan, who used to work for NHS Horizons, used to use. I think it's a Native American saying: if your horse is dead, get off it. If your horse is dead, get off it. Sometimes your horse is just dead, and no amount of defibrillation is going to bring that horse back. If you start with people who oppose your values, honestly, you will be wasting an awful lot of time and effort. So start with the people who share your values and prioritise, and be quite ruthless about how you want to spend your time. And you can think of different ways of influencing as well. So if I could have the next slide, please. Thank you. A lot of the time when we think about influence, we think about what we immediately know. And quite often this is about using logic, using data. There was a question about data in the Q&A. Using facts, debating, using incentives, evaluating. This is where you make the business case. This is where you make the logical and rational case for working across a system. And that is important, but it's not the whole story. What you also want to do, as much as persuading and asserting here on the left, is to attract others to you, to make the bridge across the silos, across the sectors, across the geographies. So again, going back to shared purpose, can we find some sort of common visioning, some sort of positive metaphors, especially at the moment when there are so many factors stopping us from taking action. Can we disclose, actually, we need help here? We've made mistakes, we need to go back, we need to do things differently. If you can get pull as much as push, you can actually really motor. If you just do push, you will tend only to get so far. And note, some people in a system will be very Machiavellian about this and will keep you on that push hamster wheel. So if you ever hear the phrase, can you just tweak that report? Can you just write me one more report? One more article, one more something, and you keep doing it because you think, if I just do this, then things will change. Might be worth thinking about instead, or as well as, what am I doing to attract others? What am I doing to really kind of bridge the system? And you can think also about how I influence, not just in terms of a report or in terms of data or in terms of relationships, but how I can influence, if we could have the next slide, please, to shift relationships, to shift perspectives. So I want to talk a little bit about framing and reframing. If I were to say to you, today is Monday, Popeye is coming to you for lunch at the weekend and he is bringing olive oil with him, and I asked you, what are you going to feed Popeye? 9 times out of 10, you would probably say spinach, because spinach is your frame for Popeye. Okay, it's how you think of him without even thinking about him. It's automatic, it's almost unconscious. It's the product of years and years and decades of you're being told to associate Popeye with spinach. If Popeye were to turn around to you and say, you know, Debbie, I've really never liked spinach that much. I don't know why I get associated with this. I'm much more of a smashed avocado man these days. It would sound weird, because it would go against your frame for Popeye. And this is what makes frames, if I could have the next slide, please, so important when you're working across a whole system and when you're looking to influence. So knowing about frames, thinking about them, absolutely crucial for whole system working. So frames are mental shortcuts that we all use. Even without thinking about it. So if you're ever due to have a meeting and your heart just sinks, oh, the blockers, that is a frame. So it's a mental shortcut that you use to images, to associations, and their frames affect the way we think. Once you have a particular frame, or once you see someone in a particular frame, then everything you say, everything they say, gets seen through the kind of the prism of that frame. You could be saying something, you know, that's diametrically opposed to how somebody else thinks about you, but if they see you in a particular way, that's the filter that they will use. Often about metaphors and values, often unspoken. So, you know, we are the good guys here, they are the bad guys. And once you have a frame in play, it sticks. And therefore it can take precedence over evidence and rationality and education and even consciousness almost every time. So if you want change, if you want something to happen across a system or in part of a system, and you go into the room, you can have evidence a mile high. If the frames of the people on the other side of the table do not align with yours, they will find a way to discount your evidence and they will double down on their frame. And if you want to see this in action, I give you the post office. So post office, start of 2024, you had the big series, Mr. Bates versus the post office. You also had a major court case in the Court of Appeal where many convictions have been quashed, and you'd had countless articles in mainstream and specialist media. You might have thought, you know, that the post office would have thought, maybe we got this wrong. This is the power of frames. The former chair of the post office was quoted in the Sunday Times, to whom he gave a large interview, and he said, the post office, quote, remains a mess, plagued by a toxic culture. Executives continue to mistrust sub-postmasters, and suspicion that they are digging into the till drawers is rife. It's still there. It's astounding when we think about it, but actually thinking about it is the wrong frame. These are things that are automatic, but although they're automatic, they are not immutable. People can turn on a dime sometimes. Frames can shift. And this is one of the most powerful tools, therefore, in your armory, because if you can get people to change how they think about something, they will change what they do. They will not necessarily admit that they have changed their minds, because it's one of the hardest things for people to do, but they absolutely will. So you see yourselves as, especially when you're working across a system, as being able to shift frames, but start before you actually have the big meeting. Really start thinking about this now, because changing a frame or not changing a frame can have real practical consequences. If we can have the next slide, please. This is partly a public health example, but is a relatively recent one in the UK. So 2019, Bournemouth Council. Their council at that time, that changed now, but at that time, their frame for homelessness was that it was a public nuisance issue. It had practical consequences. Bars on benches. Someone from Bournemouth told me that they played loud music overnight in the bus station to dissuade rough sleepers. Framing, public nuisance, practical consequences. Worthing Council, 100 miles down the coast, same political makeup of the council, took about a year, 15 months, changed their frame from public nuisance to it being a public health issue. Every councillor with responsibility for planning then voted for what had been a nurses' home to become a hostel for homeless people. And Conservative MPs like Tim Loughton defended it in the House of Commons. So changing a frame can have real practical consequences. And we've already seen this in North Wales and the impact that it has had. It is absolutely worth thinking about this. So how do you do this? If I could have the next slide, please. This is a football metaphor. You retaliate first. Tommy Docherty the football manager, was once asked, what will you do if the opposition retaliates? He said, we'll retaliate first. This is about you retaliating first in the sense that you decide what your key message is going to be. What's the argument you want to get across? What's the point you want to make? And then you are relentless about doing so. And it doesn't just need to be you. So think about who your trusted messengers might be. Might be a counsellor, might be a district nurse, might be someone in an integrated care board, might be someone in a community group. Doesn't matter who they are. If by dint of who they are, what they represent, they can get your message across, and keep that focus on your key message. So absolutely worth thinking about. What frames are you using? What frames are you seeing? How do you want to be seen? Is there a difference between the frames that are out there in play and the frames that you want to have established? What's the key message you want to get across? And going back to your allies, who do you want your key messengers to be? So it's absolutely worth thinking about this as part of influence, and seeing influence when you're working across a whole system and you're working on complex issues as a key tool in your armoury and a power in its own right. So think about who you want to influence, who your allies might be, where your opponents might be, pushing and pulling as influencing styles, and seeing yourself as having the power to change the way people think, the perspectives that they have, in order to change what happens on the ground, irrespective of the system you are working with. So, for the next few minutes, before we move on to Duncan Radley, just wanted to move, if I could have the next slide, please. Wondered if there were any questions, what there is in the Q&A. So I'm just going to go to the Q&A. Storytelling and influence and data. Lucy's posed a question about systems often like data. So it's helpful to understand the role of data here. It's, to my mind, and I'm sure Sophia and Lydia would also say this, it is both and. Never underestimate the power of a story. And the power of public narrative in particular, where you've always got an ask with a narrative. When you are looking to get to make an argument, you absolutely need the data as well, but these are things that you use in tandem, I think, to get your points across. Sarah's asked, how would you suggest providers can influence system leaders to take a whole system approach? All the things that I have suggested, Sarah, are open to providers. So thinking about who your allies are, first of all, going for a coffee with somebody, just working out, who's in my coalition of the willing here, then getting clear about the messages you want to get across and the frames that are in play for those stakeholders, so that you can adapt and adjust your messages accordingly, and then seeing what the links are across different parts of the system. And going back to that idea of building relationships and trust, making connections across the system, because quite often you find that some of the most interesting connections are the least expected ones. And, oh, I never knew they thought like that as well, or we can make common cause here. So feel your way with this. It will take time. It will take longer than you think, but absolutely work with a small group of people who feel the way you do, who can act as allies. Get an idea of what your shared purpose is, then start thinking about how you want to influence across the system, who you want to influence, and how you might position an issue, how you might frame it in order to get that message across. But it is absolutely open to you to do it. Thank you. If there are any more, if you think of anything else afterwards, then just come back to me or come back to the CHAMPS team. So now I'd like to introduce Dr. Duncan Radley. Duncan is Reader in Obesity and Public Health at Leeds Beckett University. He's at the Obesity Institute at the university, and his research focuses on applying systems-based approaches to complex public health challenges and evaluating weight management programmes. He's also a member of the organising committee for the Systems Evaluation Network and serves as a deputy editor for Perspectives in Public Health. He was a core member of the team that developed and evaluated a whole systems approach to tackling obesity, commissioned by what was Public Health England back in the day, and he continues to support the development of local systems approaches across a range of public health issues, including obesity, and he brings, again, a wealth of experience in evaluating weight management programmes. So, Duncan, can I hand over to you, please? Thank you.
Thanks, Debbie. Hi, everyone. So today I'm very briefly going to introduce two tools that could help you as part of your sort of systems approach journey. Next slide, please. To start, I'll say these tools are supposed to be the best sort of participatory processes. You can do them online, however, they are generally better and work better sort of in person. Quite often the online element I find is when you want to check stuff or verify things, you can just then have sort of quicker sort of online meetings, sort of follow-up meetings to your original in-person sort of workshops. Next slide, please. Oh, sorry, and next slide. So let's start with systems mapping. I suppose the foundations to systems mapping is really stemming from our understanding of how systems produce outcomes. So our theory here is that obviously systems are a collection of individual factors, parts, and these all interact, as we know, in this complex way, and that produces some emergent outcome, whether that be obviously levels of obesity, children not walking to school, a whole host of unhealthy behaviours which are driving sort of levels of obesity. And so systems mapping are our sort of way to start to try to understand some of these factors and how they interact. Next slide, please. So as I said here, systems maps are really this tool to help try and get at this question: why does this system keep producing this outcome? Next slide, please. There are a lot of different types of systems maps, and there's a lot of different terminology. I'm afraid people call them all sorts of things. You've got some, even on the right here, you've got spray diagrams, multi-cause diagrams. Some people just call them systems maps. Then you've got qualitative systems maps. I think something to say is they all can sort of be framed under this term qualitative systems map. The key here is that none of them are sort of quantified with data. There's no sort of simulation going on with any of these types of qualitative maps. The ones I've termed here, I've suppose separated them out just for the purpose of today as into qualitative systems maps and causal loop diagrams, which I'll come on to in a minute. So qualitative maps are the examples I've shown here. These show the components of a system, all the different sort of factors involved. They show a lot of the connections. They're really useful. They can help you identify who needs to be involved, and they can help coordinate sort of aligned actions around certain places you might want to intervene. However, as I noted, they do provide only sort of limited insight into that key question of how those factors interact to produce sort of an outcome. Next slide, please. And this is where we find causal loop diagrams to be a more in-depth type of mapping. So I suppose the difference between a causal loop diagram and those previous more qualitative systems maps I showed is that causal loop diagrams, they stipulate that the causes identified are all supposed to be causal. And they attempt to identify feedback within the system. So here is an example of a project I worked on in Wales. I appreciate you can't read it. That's not the point of this slide. The point here is hopefully you can see there's lots of sort of circular little bits in the middle. So these are all a variety of feedback loops. So this is trying to show how it's our sort of hypothesis for how those bits within the system react with each other and feedback to sort of make things happen, sort of vicious cycles and virtuous cycles of change that go on. And it's those feedback loops and the way they interact over time that sort of cause those various emergent behaviours. For instance, this one is about food preferences. So it's trying to show how we theorise how the system works to make a system geared towards a preference for sort of high fat, high sugar foods. If you go into the next slide, I've sort of zoomed in, thank you, I've zoomed in to one bit here. Sorry, it might not be that clear to read, but what you can see here, this is about marketing of unhealthy food, sort of shown in the middle. So this, if I sort of speak it around, this shows that marketing of unhealthy food leads to greater purchasing of unhealthy food, which leads on to the quality of the diet. And obviously the quality of diet affects our overall taste preferences. As our taste preferences towards unhealthy food increase, and actually consumer demand for unhealthy food increases, and this just has a dual effect. It increases the business profitabilities, plus also increases then supply and availability of unhealthy food, which unfortunately then increases the marketing. So you get this sort of vicious supply and demand of unhealthy food. Now this is just one loop within this diagram. There are other ones around healthy food and a whole bunch of other stuff. That gives you the idea of these sort of theorized loops within a causal loop diagram. Next slide, please. So why do we create these maps? Lots of reasons. Next slide, please. I'll say that all the maps, whether there's more qualitative ones or there's most causal loop diagrams, they can help you do a lot of the things which Debbie and Sophia and Lydia were talking about being necessary. They help you sort of zoom out and understand that this is a complex issue. They make assumptions in people's thinking, in your own thinking, in groups of people's, more explicit. And that really helps foster the development of this sort of shared understanding and can work towards sort of a shared purpose. So it's part of that sort of understanding and framing the work going forward. They obviously integrate different stakeholders' perspectives, so you can have discussions as you go forward. They can quite clearly demonstrate how quite distal people in the system who might not understand or initially view their role as being apparent, how they can contribute to this, and it can identify knowledge gaps. So as you're doing this, you can realise that there's some connections you don't fully understand and you need to investigate more. Further to this, I think they're also really good at engagement tools in terms of the workshop themselves, really good engagement. And they can, as Lydia was talking about earlier, they can be a process for helping you identify prioritization areas within the system. The last two, which I think probably might be arguably the most important, they help you understand how the system generates sort of outcomes, and they can help you think about identifying places to intervene. Now, I would say the causal loop diagrams achieve greater insight into those sort of last two than those just qualitative systems maps that I initially showed. Next slide, please. So this is a whistle-top tour, so really quick. I'm going to just show you some examples of how you might use these maps. So thinking about places to do. So one way, and this is a really great thing to do, is you can do what we call systems narratives. So and these are all based on sort of causal loop diagrams. You can essentially produce a story for each part of the map, the feedback loop, just in sort of layman's terms, and these can be played back and discussed within groups to say, is this what is actually happening? So it's a great thing for people to reflect on. It sort of takes it away from that very complicated maps and just puts in some nice paragraphs to people to talk through and discuss. Next slide, please. So that's one way. A new way, which is very new, this is just published a few months ago. This was based on from a group of systems dynamicists and Holland, Australia, but not these authors are all systems dynamicists, and they were really trying to get to this question of how to obtain meaningful insight without formal simulation modeling, because these guys are all, that's what they do when they do their systems dynamic, but they realized there is a place for qualitative systems evaluation, but rather than just stabbing in the dark when you have these diagrams, they thought there must be a better way to try and identify good places or potential places to intervene. So they've come up with this method. Can we move on to the next slide, please? And this is actually work we've started to use sort of on the ground. We'll be doing this with Lydia's team. So this technique does a couple of things. It allows you to assign sort of impact and control factors to variables. The idea being it tries to identify places in the system that are likely to have a strong impact. Once you do this, your factors can be placed into this type of grid. And as you can see on the top left here, it has steering factors. So these are factors which have a high amount of impact within the system, but they aren't influenced on by many other factors. So they're good places to consider intervention. On the opposite side to this, you have measuring factors in the green. So these are factors that there's a lot of stuff influencing them, but they don't influence much else in the system. So they're actually good places to try and think about if you want to see change in the system, using them as monitoring. On the bottom left, you have autonomous factors. So these are ones that actually they don't have much going on. Don't have much influence and they're not influenced by many. And then the ambivalent ones on the top right, these are somewhat messy. They exert a lot of influence in the system, but they're also influenced by a lot of factors. So they're going to be quite tricky to get a handle on, but they could be useful places to look. So that's the type of information. Next slide, please. And the next stage to this is the method also looks at sort of composite impact factors of loops. So essentially, you get an idea of the most influential loops within a system. This isn't to say that if you change these loops, you've solved the issue. It's just a means to help you explore the system and best possible opportunities to alter it. Next slide, please. Keep going. Sorry, one more. Once you have a map and you have, in this case, we've gone through the process of sort of identifying the steering factors. You can see here highlighted in green and the measuring factors. What you can then start doing is overlaying actions. So here we've seen a map around eating well in schools. And what we've done is all the little coloured circles with numbers. These are identified actions to see where current actions were being sort of taken in the system. And I've used this map specifically as a sort of example, because as you can see, there's lots of actions being undertaken, but they're not necessarily in the place where the group of people had identified as being the most impactful. So it can highlight things like that, and then gives you a starting point for saying, okay, how do we start to align actions around these places that are most impactful? Next slide, please. Another thing you can do with the maps in terms of actions is something that the researchers have called research propositions. Next slide, please. So if you can imagine, this is a causal loop diagram around physical activity and sleep quality and stress. what the researchers do here is, next slide please, they actually overlay their action onto the map. So the action here that they're trying to do is the one in yellow. So resources for street trees, that's what they were going to do. They were going to increase the money available for street trees, and then they hypothesize what they expect to happen. So they expect to see tree health, the widest tree canopy, and then reduction in pollen, in attractiveness neighborhood, and that will affect physical activity. So essentially you're creating this sort of hypothesis of how you expect an intervention to interact within the system. The idea being that this gives you a starting point for sort of your empirical evaluation. Next slide, please. Here's just some links to further information on sort of mapping and that QSTEM model and that research proposition paper if people wish to look. Right, next slide, please. I'll quickly move on to ripple effects mapping. I'll say to start, a lot of these slides are courtesy of my colleague, Dr. James Nobles, who pioneered sort of a lot of the work in this field recently. This technique originated from community development work in America in about 2015. And as Lydia pointed out earlier, it's a way of capturing and understanding the wider, both intended and unintended sort of impacts of a project or program over time. Next slide, please. One of the sort of limitations of traditional methods is you only capture sort of pre-specified outcomes. So this might be a standard type of thing. You have 10 people assigned to a cycle proficiency training, 2 were confident in cycling. You want to measure cycling confidence at 12 weeks. You've got 7 people left because a few have dropped out, and you find out that 5 are now confident. So you say 3 have improved. However, that misses a lot of what potentially could be going on in real world interventions. So next slide, please. So in reality, when people sign up, actually, there could be a whole host of other things which you aren't trying to measure which go on. So as it says here, so several people noted that roads were not safe for cyclists. They spoke to the counsellor, and this goes beyond the duration of the 12 weeks. And then the counsellor starts working with local residents to improve road quality. It could also note within that 12-week, 2 people started a local cycling group. And then even a year later, that cycling group has 30 regular members who meet twice a week, but all outside the scope of the original sort of framing and outcomes which are intended. And ripple effects mapping can help us capture that. Next slide, please. I'll just skip that, actually. It's just an interest. That was just how James has made some variations to the original method, but it's too much detail. They're not just about evaluation. I think it's really important, and we've just been doing this with a big initiative in Derby, and they've been going for about 18 months, and they found this process really cathartic because it was so slow and hard work, but actually to reflect sort of forward and backward about that hard work and all the stuff that's come out of it in that 18 months, and then get it all down there, you can see just what they managed to produce. So it really did enhance their motivation, it empowers people to carry on, celebrate the success, and it's also a good chance to reflect as you're doing it on what's working well, what's not, and that can inform sort of what you do next. Next slide, please. So what type of information do you capture in REM? There's generally sort of 3 things we try and capture. Think about events, the impact of those events, and then you also have to appreciate that there's wider context. So it's obviously, as you can see, example here on the right, we're talking about more people spending time on Main Street to do with sort of planters being installed, but you have to appreciate there's new shops appearing on the main street, and there's a variety of other sort of council intention to revitalise the city town centre that would have gone on anyway, regardless of your initiative. So I think a lot of systems work, when you think about intervening actions, you're thinking about contribution rather than attribution. So it's how does your work contribute to something? Because you won't be able to purely attribute. You're not trying to do some RCT here to attribute to cause and effect to your specific things. That's just not possible. It's too complex. There's too much going on. Next slide, please. The reality is nothing quite as neat as those. They are messy. All these types of mapping things are messy. It's post-it notes, it's big flip chart papers, it's moving stuff around, but that's fine. It all sort of comes out afterwards. Next slide, please. Further map exploration. So like with these systems diagrams, these ripple effects maps, you can do more than just follow sort of on paper. What you can do is start to think about, pull out impact pathways. You can understand which specific sort of line of action led to what outcomes and how that worked. That obviously aids your sort of future thinking around planning when you're doing stuff. Next slide, please. You can also identify the types of change. So if you want to understand, as here, they've looked at whether it was improving networks, individual changes, new income or income generation opportunities, then new opportunities for sort of publicity, organisational social changes. So a variety of different ways if you want to sort of dig into it to understand or sort of categorise the changes you're making. Next slide, please. And there's also a variety of things you can potentially learn from these. So you can, I won't talk through all of these, but this was some a project. And the themes we sort of evidence from these were sort of the collaboration with between people, a change in how people were thinking and talking or acting on the issue. Can sort of look at the generation of new funding and local initiatives, and how the work on one project might benefit other sort of strategic agendas. So it was evidence here of sort of a physical activity initiative contribution towards mental health outcomes and that type of thing. Next slide, please. And finally, depending on what information you do collect when doing these, if you do collect sort of quantifiable information as you're going through, people attending events and networks and stuff, you can also do sort of a content analysis of these types of maps to start to pull out this type of information around sort of agendas linked with a number of networks joined, additional walls and grants, number of organisations involved. But that all depends on sort of the level of detail you collect at the time, or you can sort of retrospectively go back and sort of try and fill this in later. And next slide, please. And finally, there is just a few links to some resources and QR codes there. So it's the original papers by James, some updates. And then when he was working in Bristol, they produced a lot of guides to this, and some online resources and training, sort of the blue bits there. So you could go in there and have a look if you wished. And that is me, just about done in time.
Well, thank you, Duncan. Thank you. Loads and loads of information there. Just to say, we will be sending the slides out, so you will have them. Just had one question in the Q&A from Rebecca Mead, asking, how do you reconcile multiple competing priorities with this and with a whole system approach? So when you've got sort of lots and lots of sort of potential data points, I'm getting.
Yeah, one of the most challenging things with taking any whole systems approach is this word whole. I would prefer to drop it, because you're never doing a whole systems approach. I would say you're doing a systems approach and you have a boundary to that. And the boundary depends on a lot of things, mainly the stakeholders and capacity. But at some point you have to set these boundaries. Otherwise, the whole thing can quickly scale up just way beyond control. I mean, you start at food and you eventually you're moving to food production, food farming, global sort of markets. That's not where you need to key. So you need to think about who's in the room, who's involved. Are those outside influences key drivers? Do they need to be involved? And also level of influence is very important here. If the people aren't in the room to influence those things, there's probably no point trying to map them. That doesn't mean that it's part of this start anywhere and sort of go with see where it goes that Debbie was talking about, because start where there's momentum in the system. I would say that's your starting point for mapping, and as it grows you might draw in other people and those wider influences. The only other point I suppose to make, that there is a lot of cross agenda here going on, and it endlessly frustrates me when I see people have a physical activity map, an obesity systems map, a climate systems map, and half of them have the same nodes on, and it's like factors on. It's like, actually people should talk like more before starting some of this process, these relationships building, because a lot of joint work could happen.
Yeah. I mean, just related to that, we've got a couple of minutes. We need to draw this to a close. But Danielle Roberts is asking, she's seeing a lot of organisations trying to use ripple effect mapping as a tool to capture the impact of their entire strategy with multiple work streams, interlapping systems, partner networks, etc. So she is interested to know as to whether you've noticed this as well. And are there any examples where it's actually worked, or do people need to actually sort of get more specific?
I have seen a couple do this. I haven't actually been part of those. I've only ever used it personally for sort of individual initiatives. I think it depends on the level of detail you want. I mean, these things quickly become very huge, big messes. So but if you want it, I could see how it could easily be very useful at a higher level if you keep it to not too much detail, not going into every single meeting, but you want to understand those major points throughout an initiative, and I think it could be very useful.
Yes, but just understanding what your major points are as a starting point. So doing a bit of work rather than assuming the mapping is going to sort of do it all for you.
Yeah.
Thank you. And just got one final question from Lucy Hill saying, what kinds of impacts or experiences do you think ripple effect mapping is least able to capture?
So
where shouldn't you try this?
I've got me there, Lucy. I don't know. I mean, I can't. I mean, I don't know. People, I don't know. Lydia has used it as well. If they have any comments, but it hasn't worked so successfully. I mean, because it is so open, I think, to interpret whichever way you want. I'm yet to sort of come across a particular part, because you can capture everything. You can capture changing values. You can capture networks. You can capture funding. So it's pretty much up to you to decide what it is you wish to capture. So. I'll be interested if anyone else has used it, if there has struggled with to capture certain things. So Lydia, do you have a...
Yeah, I was just going to say we've adapted it to various different scenarios. So that's the great thing. And we then talk about we've used ripple effect mapping methodology in this particular element. So we've used it when we've looked back over pieces of work and mapped out the ripples. But we also have a map in our office where we literally add in the ripples as they're happening day after day. So what I'd say is it's completely adaptable to whichever situation is in front of you, but it's worth remembering it's there for perhaps when more traditional evaluation methods aren't appropriate. So it's where you want to see that impact around system change, you want to see the relationship building, you want to see the change in system beliefs. So I guess the opposite of that, if that was a really simple solution issue and a bit back to the light switch, then maybe it would be less appropriate to use in those sorts of scenarios.
Yeah, but it's precisely the one where you've got lots and lots of overlapping factors and you want to see how they interact. Brilliant, thank you. Duncan, thank you so much for that. Sort of loads and loads of food for thought for people. Thank you also, Sophia and Lydia as well. In the next sort of 3 minutes or so, just before I hand back to Helen, would you mind just popping in the chat sort of really what's resonated with you following on from today? Maybe that might be something you thought, oh, that's interesting, I want to find out more, or that really resonated, or I'm going away to actually take a small doable action. But it would be really great for us to capture in the chat things that are resonating with you. Yes, relationships are key. They absolutely are. And it can be really frustrating as well, Jenny, because especially at the moment, there is so much churn in the system, whether it's the NHS or whether it's local government. And you've just built a relationship with someone and they leave or they go somewhere else. Oh, God, you've got to do it. You've got to do it again. But that's why have more than one. Have more than one. Yes. Set aside perfection. Absolutely. Good enough is good enough. Fine. Make a start. don't beat yourself up, Asha. If it's not perfect, spoiler alert, it will never be perfect. You will never have enough information. You will never have everybody on board. There will always be something else happening, but make a start. Thank you. Right, thank you all very, very much. And yes, just pleased to go on with this as we bring everything to a close. So I'm now going to hand back to Professor Helen Bromley just for her reflections and sort of any final thoughts and requests. Thank you.
Thanks, Debbie. Yes, it's just been a fantastic session, hasn't it? So much there to take in. I'm just going to have to put aside a few days just to digest all the information there. It's been brilliant. Just in terms of some of my reflections, obviously the importance of trust and relationships has come out really, really clearly. And also the different approaches to mapping, with systems mapping, ripple effect mapping, and some of those examples that Duncan has provided would be really, really helpful and really practical as well. There's a couple of sentences that have really resonated with me this morning, and I'm just going to go back to those. So one is the power is in the collaboration. One is the messiness of complexity is the reality. And the last one is, if your horse is dead, get off it. I think that is absolutely spot on for me. So yeah, I'd just like to remind you all, if you can complete the evaluation form, please. We'll send that out after the webinar, but it's really, really important for us. If you can fill that in and send back, that would be brilliant. And we'll also send out the presentations and recording, which I certainly will be going back to on many occasions, I'm sure. Just really to say thank you to our speakers, to Debbie, to Lydia, to Sophia, to Duncan. Absolutely fantastic morning. It's gone so quickly. The quality of the presentations, the information, it's just been brilliant. So thank you so, so much. And I'd like to thank the CHAMPS team as well, actually, for putting on this session. It's been really valuable, but it's a lot of hard work behind the scenes pulling it together. So brilliant. Well done, CHAMPS team. You've been amazing. So at that point, I think unless there's anything else, we will close today's event. Keep your eyes open for the next one. And don't forget to fill in your survey for the evaluation. So thank you, everybody, and look forward to seeing you again in the future. Thank you. Bye now.